the event as well. I'll introduce Kathy back up in a little bit. But Alex and I are going to do a little bit on overdose prevention, and then we're going to do the Narcan training at the end. It should be about 15 minutes, 20 minutes, not too long. Excellent. All right, so I'm Dr. Edward Rubin, double board certified, anesthesiology and pain management. So obviously I have to deal with these kinds of medications in the real world setting. So I train my patients on how to use Narcan. It's actually a New York State law now. You have to write Narcan with opioid prescriptions. So now we're starting the process of getting Narcan in the hands of our patients. And I'll let Alex introduce himself.
I'm Alex Rubin, his son. I'm Red Cross and Nassau County certified as a lifeguard. I'm also Red Cross certified in CPR and first aid. And the reason why we're coming here and giving this talk was mainly because of one of our close family friends who overdosed from fentanyl-laced drugs that he got, and really started the conversation about what can we do to help get Narcan in people's hands and save lives from people and prevent these overdoses from happening to someone else. So that's the main goal of today, is to get Narcan into your hands and to get you guys educated about what you can do to help prevent someone from dying. So why is Narcan training important? We all know there's a very dangerous problem out there, that being fentanyl-laced drugs, especially, and it doesn't matter what type of drug it is. Fentanyl can mean any type of drug. And we need to believe that and we may believe it's not a problem locally, and we may feel that it wouldn't happen to us, but it's simply not true. As a result, we put our heads in the sand and we don't realize the reality that these drugs are killing all of our youth and kids all around the world. So some goals for today's talk. First, we want to become knowledgeable about the danger of legal opioids. We need to believe that this can affect any one of our lives. We need to have a plan for handling an emergency situation, and we need to get access to Narcan, the life-saving medication that will actually stop someone from dying from an overdose. And one caveat is, opioid overdose prevention is a form of harm reduction, and it does not cure addiction. Narcan is just a tool that we can use to help keep all people who are overdosing alive, not just addicts. So first, we need to understand the problem. Since 1999, opioid and other drug-involved overdose deaths have been on the rise, with almost 100,000 deaths in 2020 alone. And this especially affects men, with about 2 times the amount of deaths for men as women. And while there's many drugs that can cause someone to overdose and die, fentanyl is the elephant in the room, causing about 3 times the amount of overdose deaths as all other drugs in the United States.
So what is fentanyl? Fentanyl is an opioid. It's approximately 50 to 100 times stronger than morphine. It's also quite inexpensive. For about $2, I can order enough fentanyl at my surgery center to do about 2 gallbladder operations and keep somebody comfortable under anesthesia. So this is a very inexpensive drug to manufacture and get your hands on. It's being put in as an additive to other drugs. So what we're seeing is people aren't going out trying to get fentanyl, they're going out to get something that they think is oxycodone or Xanax or even marijuana, but they're lacing it in cocaine, they're lacing it in heroin. So the bottom line is you think you're buying drug A and you're getting fentanyl in there unknowingly. The DEA actually does testing on the pills and whatnot that they confiscate illegally. And the data they put out was 26% of the tablets they tested contained a lethal dose of fentanyl. So I know some people here are Gen X, I'm a little older. You know, experimentation back in the day was a whole different animal. It probably wasn't going to kill you. Now you're literally talking a 1 in 4 chance of taking a pill and dying in minutes, not knowing what's in there.
So some other things to consider are that the effects of social media has on these overdose deaths is incredible. Especially now in this day and age, it's very easy to go online, to text someone, and to get fentanyl-laced drugs or any other type of drug that you want delivered to your door at a moment's notice. And because of that, kids as young as the age of 14 are dying from drug-related overdoses, especially fentanyl. So I wanted to show you guys something here. This would be about the amount of pills it would take to kill about 2 people in the room. And this is from standard dose OxyContin, which would be about 5 milligrams a pill. For the same amount of fentanyl, you can kill 150 people in here. So that's about 2 times the amount of people in this room with the same amount of drug. So that just shows how fentanyl can be so much more deadly, and it can be cut into all these different drugs, and you really don't know how much is in them. And it's also very easy to fake. It's very hard to distinguish what's the real pill and what's not. These people who are faking these drugs are very good at their jobs. And as you can see, this is a real one, this is a fake one, this is a real one, this is a fake one. They're very hard to distinguish, especially when you're out and about.
So how does fentanyl kill? It's an opiate, and opiates act on the receptors in the brain, including the respiratory centers in the brainstem and the medulla, and it basically depresses your body's urge to breathe. An overdose occurs when the breathing slows, and at some point your breathing slows to a point where you're not getting enough oxygen, and that's really, the mechanism here for how these meds are killing. And it doesn't need to be, because if you can rescue breathe, if you can administer Narcan, you can reverse these respiratory effects. Next slide.
So some risk factors for an overdose are decreased tolerance. A young adult experimenting is at great risk. Experienced users can get away with taking more of the drug and still surviving, but a first-time user that might be experimenting is much more likely to overdose. Mixing drugs like alcohol, benzodiazepines, stimulants, and opioids. A lot of these drugs have very bad reactions when you start mixing them together, which can cause them to overdose. Existing health issues, especially respiratory, depressed breathing, and liver, which depresses your metabolism. Both of these can affect the way you metabolize and start breathing after you start taking these drugs. And using alone is also extremely dangerous, because these users who are taking the drug alone, if they overdose, they don't have anyone to help save them, to give them Narcan, to help call for help. You just die on your own. So it's always important to be around other people if you're experimenting, which you should never do, but that especially can increase the danger level. And some signs of an overdose can be pale or clammy skin, bluish, pale lips and fingernails, limp body, slow or no breathing, vomiting or foaming at the mouth, and difficult or not able to be awoken. And another thing to point out is that heroin overdoses do not usually happen immediately, and someone could overdose over the course of 1 to 3 hours, while fentanyl, which is much stronger, can kill someone in minutes. So it's always important to act quickly.
The other difference with fentanyl is how rapidly it acts. So like if you were to take a heroin-laced pill, it would take longer to get into your bloodstream and depress respiration. So you might have an hour or two for someone to catch you before you hit that critical point. Fentanyl's got such a fast onset of action that it can make you stop breathing within minutes. And obviously after a couple minutes, then you're talking about brain damage type situation. Next slide. So how does Narcan work? Narcan reverses opioid overdose by essentially displacing the opioid molecule off of the opioid receptor. So Narcan binds more tightly to the receptor than the opioid, so it kicks the opioid off the receptor, thereby reversing the effects of the drug. Now, it will reverse the effects for sure. And the concept we want people to understand is there's really no harm in giving Narcan. It's not gonna cause any damage to your body. The only thing it does is reverse opioids. So if there's a question as to what's causing the person to be unconscious, I know the paramedics, people that work in the field, they don't even try and get the story. They just give the Narcan and see if it reverses what's going on or not. It's not gonna reverse alcohol or other substances like that. It's specific to opioids. But there's no downside to giving it, really. The thing you need to understand about Narcan, though, is it only hangs around for about 30 to 90 minutes. So depending on the dose of opioid you've accidentally or intentionally taken, the Narcan might wear off, and then the opioid can kick in again. So just because you've given it and somebody's like, come back, that doesn't mean you shouldn't call for help. You should always call for help, because that Narcan will wear off, and then the effects of the opioid can kick in again. So it's buying you a window of time to get help, but it's not the kind of thing we would give and then say, okay, we're fine now, you still need to call for help. So how to respond to an opioid overdose. Keep in mind, 7 minutes without oxygen, I mean, that's not somebody you're gonna wanna bring back. So you've got literally minutes to help this person in the situation. Basic CPR stuff, basic life support, stimulate the person, are you okay? You can rub on their chest, you can lift on their jaw. Call 911, get help coming immediately. You don't want to dilly-dally. Obviously, the next step is to give Narcan. If you have more than one person, then they always teach you, hey, you go call 911. Someone else can administer the Narcan. If you're by yourself though, just get the help on the way and then start with the Narcan. And then, it might require some extra training on your part. It's not part of this course, but rescue breathing. Obviously, if you can keep somebody breathing, even if it's mouth to mouth, you can prevent brain damage until help gets. All right, I'm gonna turn over to Kathy Lombardi from CN Counseling. She'll tell you a little bit about what they do, and she will do the training on the Narcan itself.
Yeah, I don't know if I need a microphone. Do I need a microphone?
Well,
I can't show and microphone, so.
I need a mic, I don't hear one.
Oh, okay, all right, let's do this. So, I'm gonna be so confused without it in my hand. Okay, by the way, thank you everybody for inviting us here and attending and showing that you care. It's really important that the information is out there. So obviously someone goes down, you're gonna lay them on their back, try to turn them on the back if they're in their chair and their head is down, you wanna make sure the head is back. You're gonna take your handy dandy Narcan kit. Now, first thing you're gonna do is you're gonna put on your gloves, right? And this is to protect you, because fentanyl can poison you through the skin. It's so potent, as they mentioned, right? So you're gonna put these on. You see your doctor does it, you see your nurse does it, everybody does it. There's a reason why they do that. That's to protect me from getting hurt. I already asked Alex to call 911, so he's out making the phone call, and I'm gonna administer the Narcan. If I'm by myself, I'm still gonna call 911 and get the Narcan out. So this is what it looks like, and everyone is gonna get one today. You'll see them, there should be a picture, there's a little picture there, and it fits in your hand perfectly. And what you're gonna do is you're gonna peel this little piece back here, and it goes up the nostril. Which nostril doesn't matter, right? As long as you get it in there, and you're gonna push the button, and it's one shot comes out. It's pre-packaged, it's pre-measured, you don't have to worry about if it's too much or too little. Okay, next picture. Okay, so you tilt the person's back, supporting their neck, you place the nozzle into their nostril, and then you press the plunger. Next. Now this is garbage after that, it's empty. Hopefully that's gonna work, and they're gonna come right to. They're gonna be really uncomfortable, right? Because it's gonna be like an instant detox. They're gonna wake up, they're gonna be a little confused, right? Because they thought they were just taking one pill. They thought they were just smoking one joint, whatever the word is now. And they thought they were smoking marijuana, and they're on the floor. They don't know what happened. So we always suggest that you identify yourself. Say, my name is Kathy, you overdosed, I just gave you Narcan. Because they may come up swinging, they may come up combative. They're not sure what's going on. They're gonna be very confused. So we suggest that after you do this, after you do your process, you wanna step back again and explain to them what happened. You overdosed, I'm here to help. Also let them know that help is on the way. We talk about rescue breathing, and we give you the option to do this. Because if it's someone you love, you're gonna wanna do anything you can to save them. So this is a rescue breathing mask that comes with every kit. So what it does is it protects the eyes, the nose, the mouth. Everything is protected from skin to skin contact, but there's a filter here on the mouth so you can blow through. So you can still blow the breaths into their mouth to help them get oxygen to the brain and not get poisoned by the fentanyl. There are directions in here, by the way, I will mention on everything that we're talking about. It's actually in this little piece of paper here. So let's just say, so that's the best case scenario. They wake up, they're a little confused, they're okay. We suggest that you turn them onto the side. This is called a recovery position. But let's just say it didn't work for whatever reason. There's a lot of reasons. It could be there's too much drugs in the system. It could be there are medical conditions that are blocking them from receiving the actual Narcan. It could be a blockage in the septum, in deviation in the septum. So we suggest if you do a second dose. Every kit comes with 2. Thank you, you're doing a great job. Every kit comes with 2 packages, so you can take the second one out. It's suggested that you wait like 60 seconds to make sure that the first one just is not a little slow kicking in, and you do the second one. The important thing to remember is which side did you do it on? Now you have to know, because if you're on this side of the person, you probably already did their right side. You're gonna step over to the other side and do the opposite nostril, because it defeats the purpose, right? We don't know why it didn't work the first time. We wanna make sure the second dose goes into the other nostril, very important. We're talking about the Good Samaritan law. All right, what else is in here? Oh, okay, just want to talk about some of the stuff that's in the kit. People are sometimes afraid to call for help. And that used to be a thing back in the day where people were afraid they'd get in trouble because there may have been illegal substances on the premises. They may be underage drinking. There may be just lots of stuff that's going on that should not be going on. And they're afraid to call for help. And people did not do it, and a lot of people died because of it. So that has changed. I want to say in like 70-something, 1976, I think it was, the law changed that you won't get in trouble if you call 911. Like, we know the paramedics are coming, but we also know the police are going to come. So people were afraid. Do not be afraid to call for help. It's more important to save somebody's life than to actually, worry about getting in trouble. So the important thing is to get the help on the way. You are protected. No one is going to sue you. No one is going to be mad at you. They're not going to, arrest you for even if you have drugs on you. We hope you don't, but even if you do not be afraid to call for help. And then we talk about this stuff in the kit. So there's a little blue certification card in here. So when you get home, you're going to put the date and you're going to put your name on it. And this shows that you've been trained, that you've actually had a training. So let's say you did get pulled over. Let's say you had a bunch of blue kits in your car. And someone says, why do you have all these blue kits in your car? You can say, look, I'm certified. I am trained. I'm not going to a party. I actually want to help somebody. I want to save someone's life. So this certification card is also important because let's just say you used your Narcan kit next week and you need a new one. You can get a free refill using this card at most drugstores, most CVS, most drugstores. Even sometimes the fire department or the police department, as long as you have this, it's free. If you go to the drugstore, they may ask you for your insurance card. They will charge your insurance card. There's no cost to you, but you'll get another Narcan kit. The other thing that's in here is fentanyl testing strips. So guess what? We want people to not die. We want people that are still using to use safely, right? So if you have something and you don't know where it came from, and maybe it's not you, but you know someone who is using, these are available to the public, right? We can supply these to people. You can actually test your drugs to see if they're safe, right? We want people to not die. Very important, harm reduction. So we tell people do not use alone, because if you're alone, no one can help you. And as you can imagine, COVID increased those numbers as well. People were using alone, people were dying alone. We suggest that the testing strips are included in the kits because we want people to know they're available. Although you may not need it, you may know someone who does. So we give these out free. So our information is available in the package also, which is the last piece that I will talk about. And this is our card, right? So you use your Narcan kit next week and you need a new one. Our phone number's on here. We can supply you with a new one if you can't get to CVS. Our number's on here in case you know someone who needs help. Our information is here. We are a mobile unit, right? We help people with mental health and substance use disorder. We are peers in recovery. I'm a person in long-term recovery, as what my colleagues here are helping us with the paperwork in long-term recovery. And we help people, hopefully beat their substance problems and work on their mental health. We're a mobile recovery unit, so all of our information is here. So the other thing I will talk about, I think we talk about expiration dates. There's an expiration date on the back of every kit. So in 2 years from now, or 3 years from now, depending on what date you got, and you need more, you can use that card also to call us to get more. So it's expired, you can get a new kit. So I will tell you a quick story about a gentleman who had Narcan in his house for about 7 years. Never thought he would ever need it. His son went down in the living room one day, he ran upstairs, grabbed that Narcan kit from an old pajama drawer, ran down the stairs, and was able to save his son's life. So old Narcan is better than no Narcan. Do not throw it out. When your kit expires, go get a new one. Make sure you still have a new one, but don't throw out the old one, right? Save it. It's still better than none. We talk about storing Narcan, right? You want to make sure that you keep it not too hot, not too cold. You don't need it in your car in the winter. You don't need it in your car in the summer. It's also better just to have it on you. What's the point of having it if it's back in your car and we're in here, right? Anyone can overdose. It's just not the demographics that we're used to, right? It could be someone who had pain pills. It could be someone who had surgery and has a pain patch, right? And then they took the prescription not realizing they had the pain patch on, or the nurse came. It could be Aunt Mary, It doesn't have to be a young kid in school, it could be Aunt Mary, and we want to save Aunt Mary, it can happen anywhere. So have the Narcan kit on you. It's more important to have it on you than to have it in your car. But hot Narcan or cold Narcan is better than no Narcan. So I will say that as well. And we ask you to report something if it happens. There is a way, if you call us, we can get you a form to report an overdose. Those numbers only get better, or the numbers are only accurate if we're reporting things that are happening. We don't know what's happening in the community if no one's talking about it. Alex said it very nicely, putting your head in the sand doesn't help. Putting your head in the sand doesn't help anybody. We need to talk about what's going on. We need to stop the stigma of addiction, right? Everyone knows someone, or maybe is someone who has a problem, right? We can't get help if we're not talking about it. And we see it changing every day. Like, I remember as well, we're in the same age category. There was a time you didn't talk about your problems. You didn't talk about what's going on. Now it's on every TV commercial, it's in every community, and everyone's talking about it. And I think it's a big change, and hopefully this is gonna affect the numbers. But if you're not letting us know what's going on, we can't help. No one can. So it's really important. So reporting those numbers are important as well. And it's anonymous, and we'll tell you that. It's just, we just wanna know when, where, and how. We don't care who, we don't want anybody's name, we just need to know that it's happening so we can, service the communities that need it the most, which right now is everybody. So I think we're done on that. Yes, here's some information. I'm gonna leave some information on the back table. Everyone is gonna have a card with all the information. We did give you forms, and I'll explain to you real quickly why we had to give the forms. We're a state-funded program, right? This is a grant that allows us to come in here and do these trainings and make these kits free, because someone shared earlier, they priced out a kit. It's approximately $170 to buy a Narcan kit. So why can we give them out free? Because the state has given us the funding to do that. So we need the paperwork back from you. Everyone who's here today that's over the age of 17 is going to get a kit. That doesn't mean that you can't educate yourself and go home and give it to your teenager. It's very important. We can't dispense the medication, you can. If you feel like you have a teenager who needs a kit, thank you for taking the training and making sure that the kit gets into the right hands. So everyone who's here today is gonna get one. That's why we're gonna collect the forms. It does ask for your birthday. It asks for your birthday because we need to prove that everyone is of age. You can write